Hi everyone! September is GYN Cancer Awareness Month, so I wanted to talk to you this week about breast and ovarian cancer. Later on in the month, I'm going to circle back with uterine and cervical cancer, but today in this 5-minute video, we're going to touch on the most important things I think you need to know about breast and ovarian cancer. Now, when we think about cancer, that is a terrifying word for many. And some of you who are listening have already been through that journey. Some patients have come to me, for an annual exam in the office, tell me, just tell me I don't have cancer, right? It's a really scary diagnosis and everything that it implies. And there are non-modifiable and modifiable factors that go towards any of these diseases. The non-modifiable things like our genetics, we can't really do anything about. It's the cards we have been dealt. But there are several modifiable risk factors, and I want to empower you to learn about those and take action and really make sure that you are giving yourself, the best chance for a long and healthy life. So let's get down to it. 3 main points about breast cancer and 3 more main points about ovarian cancer. Let's start with breast cancer. Breast cancer is the most common GYN cancer diagnosed in the United States. 1 in 8 women will be diagnosed with breast cancer. That's a lot. That's a very sobering fact. So it is a very, very common cancer. And I'm sure a lot of you know somebody, friend, family member who's had it. The second point about that is screening for breast cancer starts at age 40. And that's what the American College of OBGYN recommends. Now, the American College of Physicians, so your internal medicine doctor may say something different, like 50 years, but your OBGYN will say 40. And that is what I recommend, again, because of the incidence of breast cancer. It's so common. So you should be getting a mammogram yearly, starting at age 40, and you should be getting it every single year. If you have dense breasts, you should be getting a 3D mammogram. So make sure you're asking your doctor to look at your previous report and tell you whether your breasts are dense or not. And it's it's not a very complicated additional test to do. It's just the way they take the images are a little bit different. So make sure you're getting that 3D mammogram if you need to. And lastly, the 2 most modifiable risk factors for breast cancer are obesity and alcohol intake. So obesity, it's rampant in the United States and in the Western world. Our diet is just not as good. We don't move as much. And there's so many programs out there that are aimed at, helping you to eat more nutritious foods and helping you with exercise to get to a normal BMI. So I would encourage you to do everything in your power to try and eat better and exercise more to get back to a normal BMI. And the second factor was alcohol intake. I think in general, we all are probably drinking more than we should. There were some studies before that said, a glass a day of wine helps your heart. Depending on which study you read, there's so much conflicting information on this. But the prevalent notion now is that more than 3 drinks a week definitely increases your risk for breast cancer. So I tell my patients 3 drinks a week. Okay, so to summarize the breast cancer portion, most common cancer for women in the US, 1 in 8 women will be diagnosed. Mammogram starts at age 40 and should be done yearly until, whenever you want to stop it. There's no stopping age. And number 3, the most modifiable risk factors are obesity and alcohol intake. Okay, so moving on to ovarian cancer. Now, this is a scary cancer. There is no good screening test. Women are often presenting very late in stage 3 and stage 4. 70% of women present in an advanced stage. Some of the common symptoms that we talk about are bloating, feeling full early, unable to, button your pants, weight loss, things like that. So regarding ovarian cancer, it is the most deadly cancer for women. It's not the most common, but it is the most deadly. And for the reasons that I just mentioned, a lot of times women present very late in the game and there's no good screening test. The best thing you could do is really see your gynecologist yearly. A lot of patients say, well, I don't need a PAP, for another 3 years, so I'll just show up in 3 years. But often when I see women yearly, I'm able to tell that, sometimes that their pelvis is way more bloated than it usually is. And when it's happening in your own body, it's hard to tell sometimes because you're used to your own body. And when there are slow changes like that are happening over months, it's hard for you to tell. So it's helpful to get like another pair of eyes. And also sometimes we can feel a big mass sitting there. So make sure you're seeing your GYN. Number two, only 15% of ovarian cancers are genetic. So we've heard a lot about the BRCA gene, the breast cancer, ovarian cancer gene, but only 15% are genetic. So the rest, 85%, are sporadic, which means I don't know who's going to get it. So really paying attention to your body, being in tune with your body. And again, when you're of a normal BMI, you're going to be able to be a little more sensitive to subtle changes like bloating. Otherwise, it's hard to tell. You're like, is that just me, like my body, my extra weight, or is something really going on? And number three, being on birth control for 5 years or more halves your risk of getting ovarian cancer. So it cuts down your risk of getting ovarian cancer by 50%. So a lot of patients are very concerned about being on birth control pills for various reasons, but this is a great benefit of being on birth control pills because it shuts down that ovulation, prevents any possible mistakes that are going on from repairing the ovarian cells after ovulation. And so it cuts down your risk by 50%. So to summarize the ovarian cancer part, it is the most deadly cancer for women. It is only 15% of ovarian cancers are genetically linked. And lastly, being on birth control pills for 5 years or more cuts down your risk of getting ovarian cancer by 50%. So I hope you found this information useful. And I encourage you to take at least one step after listening to this video. Take one step in doing something for yourself along these lines of helping yourself get better with one of these risk factors that you may have, so that you can minimize your chance of getting breast cancer or ovarian cancer. With my next video, I'm going to talk about cervical cancer and uterine cancer. Please tag a friend who could use this information. And if you have any questions, please comment or send me a message. Okay, until next time. Bye.